everyone, and welcome back to Cat to Vet Tales, where I chat with feline experts all about how we can keep our cats happy and healthy. I am so grateful to be able to collaborate with Royal Canin on this Catology series, as well as the Take Your Cat to the Vet campaign. I feel really passionately about this campaign because it's so important for people to understand the signs of illness in their cats and to be seeking regular veterinary care from their cats. So remember, you can find all of the episodes and more at kittenlady.org/catology. But I'm excited for my guest this week. My guest this week is Dr. Diarra Blue. He is a veterinarian and co-owner of the Cy-Fair Animal Hospital in Cypress, Texas. You might know him from his TV show, The Vet Life. And he and I have also collaborated on the Take Your Cat to the Vet campaign for the last 2 years. So it's really exciting to get to talk to him today. And today we're going to be covering an important topic, which is adult and senior cat health. So thank you for being here, Dr. Blue, and welcome.
Oh, Hannah, thank you so much. It's good to see you again. Always good to work with you. You did a great job, by the way. Not that you don't do a great job every time, but I looked at the video, the PSAs. Amazing job. And
thank you. You too.
Very happy to be here and share some knowledge and see how we can help the world understand cats a little bit better and make sure we get them to the vet.
Exactly. And thank you for that. You did an awesome job too. And I think it's so important for us to have this conversation with the Take Your Cat to the Vet campaign happening right now. We're encouraging people to go in for regular vet appointments. And I think it's so interesting that when it comes to cats, a lot of the time people wait until their cat is really sick to go to the vet. I was wondering if we could start by just kind of talking about the importance of taking your cat to the vet on a regular basis, even if you don't think that they're sick. Why is it important for people to go to the vet, even if they don't know if their cat is sick?
I mean, if you want to put it in the most simplest terms, think about it like this. You would go to the doctor every year or twice a year or as needed. I mean, a cat's no different. You have to understand that these animals are sitting at home with us. They're eating food that sometimes they shouldn't be, sometimes they on a perfect diet. You know, they're born perfectly healthy, sometimes they're not. All of these little things that we do or don't know about them are the same thing that we would be concerned with ourselves about, so we should be concerned with cats. They can't speak. You know, you can tell you, or your kids can tell you, hey, my leg hurts, my back hurts, my bladder feels weird. A cat's just sitting there meowing and kind of just disappearing on you, and then you're wondering why. You know, we have to be involved in their health and try to be their advocate and really try to see what they're saying. And they'll never say anything because cats are truly wild in that sense. Dogs will sometimes kind of let you know they're sick. Cats won't. They'll disappear, like you said. You won't get them to the vet. Sometimes it's too late. They're sick and dying. So just as a general thing, you should take your animal yourself to the vet once a year as an annual purpose just to make sure everything's normal. And then we got all the other stuff that we can talk about on top of that.
Yeah, thank you for that. I think it's a great recommendation, at least once a year. And then when you're there, you're going to learn so much, and they can let you know if you do need to be going more often. One of the questions that I wanted to ask you about is about the importance of preventative medicine. So not just going to the vet when your animal is sick, but also doing things to prevent illness from starting. And one really important part of that is vaccination. I work with neonatal kittens, so obviously, you know, once the kittens are old enough, we vaccinate them and they get their boosters, and then they go to their adoptive homes. But a lot of the time, people are surprised that it doesn't stop there. Like they may need to do some additional vaccination even once the cat is a bit older. Can you talk about why just getting like one vaccine or 2 vaccines as a baby is not the full recommendation, and why people should be going back in as their cat is an adult and getting booster shots for them?
Right. That's a good question. Well, you have to understand the way the body's immune system works. And I don't expect for anybody here to become an immunologist overnight. You know, this is something that we've had to study to become veterinarians several times, undergrad, vet school. It's one of the things that the way that the body immune system works, it works like on a remembrance. So if you ever done a push-up one time for the first time, it was hard, and you probably told yourself you never want to do it again. But when you go to the gym and you constantly do these push-ups, it's like, oh, they're not so bad. You got to remind your body that you can do these push-ups. Well, the same thing is with immunity. You can't get a shot one time and think that the body's going to be like, I'm a superhero now. I can fight these diseases. Like, no, it doesn't work that way. It can fight them for that moment. Once it realizes that it has this virus or this bacteria. But once that goes away over several years, you have to remind the body. And that's what vaccines do. The same things we do for our children. So I think right now is a prime time where people are understanding immunology a little bit more than they ever would because of coronavirus. And because of that, I use that example. It's important to remind the body of the illnesses. And this isn't like coronavirus where it's new and rare. This is stuff that's been out for years. A lot of people allow for their cats to go indoor, outdoors. You know, it takes one bite from another cat that has feline leukemia or feline AIDS that can give these cats these diseases, and your cats, you know, can be sick or pass it to the rest of your cat family. Just things simple as that. And preventative care, I want to talk about that, Hannah. Just let me jump onto that. You mentioned, you know, why it's important.
Oh, yeah, please.
Yeah, you know, the purpose of preventative care, you know, it's the prevention before you get to it. If I can change my oil for $39 and prevent my engine from breaking and then having to replace my whole engine for $3,900, it's a big difference. You know, trying to get rid of fleas is much harder than preventing fleas. Trying to prevent the disease that fleas cause is much harder than getting rid of the disease that fleas cause. And that's just one little thing. So preventative medicine is so important, and it's less expensive, and it's healthier. It just prevents everything in the beginning. Again, you don't want to deal with the problem. You don't want it to flood. Build a dam now. Let's build a dam. Go get you some beavers. Yeah. Build a dam. Okay. Let them take care of the water. Flood your house. Now you got to rebuild. It's just a bad day. Crazy analogy, but it works.
No, I love all of your analogies so much because I think, you know, bringing a little bit of that kind of like analogy and humor into it can help people kind of go, okay, yeah, that makes sense. And I think, you know, I love what you said. We can't expect people to become immunologists overnight. If you just gotten your first cat, like, of course you don't know everything that you need to do, but that's why making that first vet appointment is so important, because the vet does know what needs to happen. And you're totally right that it is a lot more affordable and just like takes less time to just do things right ahead of time so that later you're not having to, you know, address those issues. So thank you for all of that. I want to move on a little bit to signs of aging. There was a survey that Royal Canin published this week that I thought was very interesting. It had a statistic that 72% of people don't pay attention to the signs of aging in their cats because they believe their cats seem younger than they are. I know that's something I hear a lot, like, oh, my cat, you know, they seem really young. They still act just like a kitten. But the danger of that is that they also found 6 out of 10 people don't even know what the signs of aging are. So can you talk about signs of aging, what people should be looking out for when their cat is, you know, growing older?
So I think it's going to be difficult because some people don't even understand the signs of aging in humans in themselves. You know, you get older, you start acting more mature. You're supposed to do things a little different, think a little different. The body functions different. The recovery is different. You know, it's the same for animals. Signs of aging are not just going to be simply gray whiskers or graying of the hair, changing of the lens. You're not going to just see those common things. They're going to be signs internally that you can't see. And that's why, you know, it's very important to really see the veterinarian. The signs in cats, you may have a cat that looks the same for the past 5 years, but her kidney function has diminished greatly. All the years of eating that high protein food or the abnormal diets, excuse me, you know, has allowed for their kidney functions to diminish. And that's one of the most common disease processes that we see in cats. And honestly, you won't see those signs until it's too late. You won't see it until like, Doc, yeah, I think my cat's got a urinary tract infection. It's excessive urinating or excessive drinking. These are signs of changes that are related to the kidneys as a result of age and or damage. Some of the other signs is we don't talk about enough in cats is arthritis. We do not talk about arthritis in cats like we do in dogs. These guys develop arthritis just as well and can be just as debilitating. It's so important that we have those joints monitored and maintenance, and even prevention given to them for like joint supplements. You might start to see them not jump as high or as much on things, or more timid to jump on things. Teeth, the teeth as well. They always dropping food off one side of the mouth, or chewing only on one side, or their breath smells funny. Those are signs of changes that you'll see because of aging, not only just because of dental disease, because of age-related changes that cats can develop. And they have a special disease that they can develop called feline odontoclastic reabsorptive lesions. Bunch of big words that means they start to get damage to their enamel of the teeth, and it really can make the teeth brittle and painful. And you can see this in cats. It's an actual feline disease. So these are all changes that you need to be concerned with. And as they grow and age, I think that we need to be at the vet constantly so we can remind the vet, hey, can you check my baby out? And the vet reminds you, hey, this is what I'm seeing. It's an exchange that we have to understand what's really going on with our kittens.
And can you talk a little bit about at what point is a cat considered a senior, and what is the difference between what you would be doing at a regular checkup for a young adult versus a senior cat? Like, are there different types of tests you're doing? What can people expect if they bring a senior cat to the vet, and what should they be asking for?
Absolutely. So with the age-related changes, there's certain things that we look for in older things that we don't look for in younger things. You don't expect for a new car to have rust. You just wouldn't really expect it for that. Whereas an old car, you're like, where's the rust? I need to find it. So there's things that you're looking for that develop over time. Well, with those senior cats, which we say a senior cat is about 7-8 years of age. Okay, we're not an adult anymore. We're senior now. We're looking for things more related to their thyroid. Cats are notorious for getting a condition called hyperthyroidism, where the thyroid starts to grow excessively. It usually is a form of cancer, if you will, and it grows and it starts overproducing a hormone. So we're testing for that as a part of their blood work all the time. We're always testing their blood pressures in general, but especially when they get older, because cats tend to develop hypertension. Obviously, as they age, again, kidney failure being one of the most common diseases, we check for their kidney values. There's tests we call SDMA. There's one that's BUN, creatinine, then, of course, the urinalysis and UPC. We use all that in the conglomerate to really just get a good picture of everything. Even when they start to get more older, we talk about doing preventative chest x-rays, checking for cancer or metastasis and even spread of cancer. So those are the things that we look for in older cats versus a younger cat. We're checking for GI parasites, which we do in adults as well, but GI parasites, making sure their vaccines are up to date, making sure that their CBC and chemistry are just normal in general. Those are some of the major differences. And then obviously, like I mentioned, the teeth, the older they get, the more damage to the teeth we see that can lead to major issues.
Well, that sounds so thorough, and I wish that we lived in the same city, because I would definitely be taking my cats to you. I really appreciate all of that information, and I think it is important for people to know what to expect when they go to the vet, and also to be really advocating for their cats to get that level of care and just that level of curiosity. I loved what you said about the really trying to find the rust on the old car and being like, I know it's here, let's find it.
Right.
I wanted to bring up, I do tons of adoption interviews, and part of the adoption interview is asking about, prior animals that they've had. And I notice a big difference between people who have taken their cat for regular vet care and people who have not. Because when people have not, a lot of the time they'll say, well, my cat that I used to have died of old age. And then when people have taken their cat to the vet a lot, they'll say, well, my cat that I used to have died of, X reason, lymphoma, they died of heart disease, they died of kidney failure. And it strikes me that a lot of people kind of just think that diseases of aging are a given, and so they are not staying curious about their cat's health and really trying to seek out information that could help them. And unfortunately, I think sometimes a cat who is 12, 13 years old, people go, oh well, they're just an old cat, they're just aging. but there could be something that you could be doing to help them and really extend their life. So I'm wondering if you can talk a little bit about that and like some of the, I mean, you've talked so much about some of the diseases that you see in aging cats, but just how important is it for people to be curious about those things?
Yeah, so I actually love that statement. Be curious about your cat. You know, if you were trying to figure out what's wrong with your plumbing, unless you're a plumber, you would call a plumber, right? You would trust the expert. You know, and I don't know what on earth has gotten some people to the point where it's like the vet isn't the expert. I don't know if it's because of Google or because of all these other
internet
people vet, you know, that say they know animals, you know, all that's fine, you know, that's no disrespect to anybody. My thing is this: if I felt a lump under my breast or my armpit or my neck, I'm a veterinarian. I wouldn't be like, I know exactly what that is. I'd be like, you know what? Maybe make me an appointment. I'm going to the doctor. You know, I'm a hypochondriac at this point in my age. I got 3 kids, so I want to be around. So I'm going to be like, hey, I go to the doctor. I don't know why we're way about our animals. And I do understand as a veterinarian, particularly cats, it can be a challenge because some cats are just, they say, I'll say it. It's fair. I'm a vet. I can say it. They're jerks. And you might have had an experience with a cat that was a jerk, but you shouldn't assume that behavior for all of your cats, nor should you allow for that be the reason why you don't take care of that cat or be curious about it. You know, we have too many opportunities now that, you know, defeat the previous thoughts of, well, my cat, I can't get it to the vet because it's mean, it's a jerk, or it pees in the kennel every time. Well, cleaning up pee is easy. My office will take care of that if you come on down. We have medications you can give these guys beforehand that just calms them down quite a bit. You know, in the worst case scenarios, we have to sedate these animals and we do all the work. So don't take the onus on yourself. Engage your veterinarian. Say, hey, listen, I have a cat that's this, that, and the other. Okay, this one's easy to get to the vet. I should see him all the time. This one's more difficult to get to the vet. Okay, give him this and bring him over, and then we'll get a good job. You know, we'll do our job to take care of him. Well, this one, doc, I can't touch. Okay, this is how we're going to address this one. Let the vet deal with that. You don't deal with the drama, okay? Yeah, it may take some time with, you know, wait times and all that. We'll get that. We'll talk about that. But you get the animal to the vet so we can figure out the process as to how to make sure this animal is taken care of properly long term. Maybe we don't see this cat every 6 months. Maybe we just do once a year for your cat because this cat has an issue. But if we don't know if there's an issue, we can't even address how to start fixing that problem. So I just want people, like you said, to really be curious and don't be the expert. If you're not an expert, leave it to the expert. Bring the cats in. Let's have a conversation about how to approach, you know, the treatment and prevention of these animals. Because it's just, it's too important. It's too important. And there's too many things that you will miss until it's too late for a cat.
I love everything that you just said. I think that is a thing I hear a lot is like, well, I would go to the vet, but like my cat doesn't like to go to the vet. And I think like, well, if your child doesn't like to go to the doctor, you don't just like not take your child to the doctor. Like, you know, you have to, they have to deal with that. And there are so many things that you can do to make it a better experience for your cat. And like you said, it's also the veterinarian's job to make sure that that goes well for the cat. Is there anything that you can share with people who, you know, maybe do have a cat who's really difficult to take to the vet, like any encouragement about how to handle a cat who just does not like to be in the carrier or who's very afraid of being in a new place? How do you handle cats like that in your clinic?
Absolutely. So here's the magic. First time you do something is always difficult. Okay, period, point blank. I'll go back to my push-up reference. First time you ever did a push-up, it was hard. You're not going to get a cat that doesn't like to be handled anyway to just jump in the carrier, take it 3, 4, 5, 6, 7 miles to the vet, and then go in there and be nice to everybody. It's never going to happen. It should be a process that you're like, okay, we're going to the vet one day soon. Here's a kennel. Put the kennel out there so they can see it. You know, push them in the kennel. Put some food in the kennel. Work with them around the kennel. Close the kennel up. Let them out the kennel. You know, work through the process so they can start to become associated with this versus this brand new bear trap that they're getting into and they're freaking out. understand that that's a reality for anybody. Once we've done that, then we start having a conversation of, hey, doc, is there something I can give my cat? Yes, we got pheromones, we have drugs, we have heavier drugs, we have injectables if we have to, we have gas. I mean, there's just too many arsenal, too much in our arsenal that we can use to have any excuse or reason. So my suggestion is know your cat, get them acclimated, talk to your veterinarian about what medications you can use before, after, or during, and then activate on it.
Yeah, and I mean, I want to mention too that, there are feline only clinics out there if your cat is really scared of being around dogs. If it really truly is a problem to take the cat out of the house, there are vets who do home visits, So there's a lot of different options to make it work for your cat, but doing nothing should not be an option.
Correct. I agree.
So I want to talk quickly about some of the most common diseases that we see in adult and senior cats. Last week, I was speaking with Dr. Bautista about renal health in cats and kittens. I actually adopted a kitten recently who has kidney disease. Is there any advice that you could give people who are going through kidney disease with their cats? Any encouragement or just kind of like information that you can share about things that can be effective for a cat who's going through kidney disease?
Absolutely. So one of the number one diseases that we see in older animals, or older cats, is chronic renal failure, kidney disease. When we say renal, we're talking about the kidneys. It's a staple in cats. There's pretty much, one of those things that probably 1 out of 3, 1 out of 5, depending on the age or breed or what was fed to it, or they're going to get kidney disease. It's that common. To encourage anybody is to understand that we've been dealing with this long enough to know how to assist and prolong life in the best way so they can have a great quality of life long enough. And it's just something where between diets, between treatments, between fluid therapies, not realistically, but even some rare cases, renal transplants, there are just too many tools that we have to deal with these issues. I want to be very realistic to everybody that has a cat that is going through renal failure. Every veterinarian, I'm sure, has seen it. And it's something that they can help you with by recommending the best diets to be on, recommending a protocol for checking the blood and the urine to make sure we're not getting too high in those values, and then also diluting the body. Remember, the solution to pollution is dilution. The kidneys is a filter for our body. It flushes these things out. Well, when the kidneys aren't working, it's not flushing it out. The water's leaving through the urinary system, but the toxins that leave with it are staying in the body because the kidneys can't do their job. So we have to give excessive amounts of water to dilute that. That's why we do that subcutaneous fluids. And sometimes they have to actually stay in the hospital on an IV to really flush out, just like a person with kidney failure that would have to do dialysis. So understand that the science is known. It's not rare. Understand a lot of the times, the majority of times, it is not your fault. This is something that we face with cats, and we have to work through it. The older these cats get, the more stress we put on their kidneys. And with technology and science and things, cats are living longer, so we're seeing more of it. It's not that they're sicker. What are we doing wrong? It's because we're doing something probably too right that we're seeing it more often. Because these guys aren't dying at 6 and 7 and 8. They're dying at 17, 18, 19. Well, I think everybody's 90-year-old grandma got some problems, So I just think that we're starting to see it more in reality because we didn't used to see it. The life expectancy is longer because we're doing something right. So just understand that this is a difficult thing, but if you listen to the vet, if you really understand what's going on, you can really prolong their life and really give them a good quality life through the process. I just want to touch on the other part of your question, that those top diseases, you got the kidney failure, You got the liver issues in cats. They get these liver issues when they get fatty livers and things that usually go with their obesity, which is one of their major issues. Dental disease also is another. But we kind of usually put those on the back burner because everybody's like, oh, being fat and have bad teeth is all normal. It's not normal, but we should correct it. However, you have your kidney disease, your liver disease. Lymphoma is a very big one in cats. I think behind kidney disease, I would say lymphoma is one of the ones I see the most. And it's a very, very debilitating disease. Cancer it usually sits in the GI tract, or we call the alimentary tract of the animal. And it can really start to cause problems simply as diarrhea and vomiting, and then it goes full force from there. Those are going to be some of the major ones. Then we do see some heart disease, and that can be either genetics and or sometimes the diet as well.
Wow, there's so much. I wish we could just keep talking all day because there's so much that I would love to ask about. I mean, I think vet med is so magical because, like you said, with interventions for kidney disease, you know, I'm going through that right now with my little guy, and he's already far surpassed his life expectancy just through that intervention. So pretty incredible stuff. I wish that we had more time to keep talking, but I want to ask you one thing that I think applies to a lot of different conditions, which is in human health. You know, if you're whatever you're talking about in human health, the answer often is diet and exercise, you know, like the nutrition that you take in and the exercise you do with your body. How similar are cats to humans in that way? Like, what role do diet and exercise play in an aging cat? And how important is it to be thinking of those two factors?
So I haven't seen a living species that I can say yet that the diet and exercise don't play a role directly, just like in people. And I'm sure somebody's going to see this and be like, Dr. Blue, you missed one. You're wrong. There is one. I'm sure there is. Listen, at the end of the day, what you put in is very important. And it actually affects what comes out. That's just the truth about any living thing on earth. So I will say this. It's imperative that the food we put in our animals, the amount of food we put in our animals, the amount of water that we put in our animals is, you know, monitored and very closely and done properly. Cats are probably the most common obese animal that I see. Oh, he's not that fat. No, he's that fat. That fat. Yes, he is. And it's usually because we free feed them. We allow for them just to eat whenever they want to. And then what do cats do? They love to sleep. You know, if you look at a lion in the wild, you'll never see one that's fat. If anything, you probably see them mostly, they're usually skinny. And you think they need some groceries. And we have to be concerned with, over time, how that fat is affecting them. It truly does. Diabetes, one of those top diseases that I did not mention because I knew this question was coming. It's right up there with kidney disease and lymphoma and liver disease. It's diabetes. It is probably one of the number one diseases that I treat in cats because we allow for them to just become obese. We allow for them to eat too much, too often. We don't regulate their metabolism. We've got to be very careful with them. And that's also back to the kidney failure.
What's the relationship between weight and diabetes? And what should people be? Because that seems then to me that diabetes would be something quite preventable. So what is the relationship there? What could people be doing if they are concerned that their cat might be gaining too much weight?
Depending on the type of diabetes, it is preventable. So that's one reason why we need to be careful. But the way diabetes works is that I think the easiest way for me to explain it's like a balancing act or a reflex arc, if you will. If I tickle you, you're going to start laughing. If I tickle you a little bit, you laugh a little bit. If I tickle you really hard, you laugh really hard. Well, when it comes to obesity, you start to introduce all this fat, all of this extra storage, all of this extra food. The body starts to become desensitized to the hormones that regulate how we store fat and use energy, okay? This is a whole cascade that our body understands. Well, when we start to tip those scales in the wrong way too far, the body can't push that scale back, and the bottom falls out of it. And literally, your body will not respond to one of your hormones called insulin that you produce, or it might just stop producing it, okay, in total, and then you don't have it available to be made. So the way that we deal with our diets allows for our body to use that hormone as needed. And when we overdo it, it's kind of like if you eat steak every day. You eat steak every day, that's not a special dinner to you. Somebody take you to get steak, you're like, I eat this every day. You need something rare like ox meat or something, or like alien feet steaks to be like edible to you, to be like, oh, this is good, because you eat steak every day. But if you're accustomed to eating some hot dogs and some bologna and some steakums, and then you get a steak, it's like, oh, wow. And then don't add a little bit of Oscar on top. It's like, whoa, this is a delightful meal. Your body needs to understand that it can't get used to this all the time, because that becomes as normal, and that's how we get that disease. So that's how weight and diet play a big role in diabetes. We have to understand that once you inundate it with that, it starts to become accustomed to it, and nothing starts to work. It becomes its normal. That makes sense?
Yeah, it does. What about senior diets? Like, should people be putting their cat on a senior? So this is my cat, Coco. She's been sitting here with me.
Coco.
She's my senior girl. Coco is, 12 and a half years old now.
She's good.
I've had her since she was a couple weeks old. And I remember when I put her on a senior diet, I was like, no, like, I didn't want to admit that she was a senior. But what happened is I put her on a senior diet, and she actually started looking more youthful. So it was sort of like, oh, I was sitting here feeling sad that you were on a senior diet, but actually she became shinier. She had more energy. So what makes a senior diet? And, should people be using them?
I'll say this, excuse me. I'll say this with 100% confidence. That's one of the things I love about, Royal Canin is the life stages. If your animal's a senior, put it on senior food. When you were young, you can just eat hot Cheetos all day. And you'll stay nice and fit and all of that. I can't do that anymore. I have to eat vegetarian half the time to get my body to look right. I can't even eat the meat like I want to. Things change as you get older. And the faster that we understand that, the better for us and the cats. These guys need to be on senior diets when they're senior, because you don't need a certain amount of stuff in your food when you're older. Your body is developed to where it's going to be. So it don't matter how much more protein or how much more calcium you put in it, you're not going to get taller. What you're going to do is start inundating those cells with those extra proteins and those extra elements, and they cause damage. So senior food reduces the amount of things in the diet that allow for the body to grow when you're younger or an adult when you need them. You don't need that. That's why they have vitamins for kids, and then they got vitamins for adults. You don't need all of that stuff when you're a certain age. So that's why this life stages is very important. Royal Canin does a great job with that. You get your kitten food for your kittens. Okay, you get your adult food for your cats. Excuse me. And then your senior foods for your seniors. And then you got your weight loss food for your weight loss. And, we just need to make sure that we're understanding it. And if you don't understand it, don't just decide that you're the expert again and buy whatever is cheapest or buy whatever is there. Get what's good for their life stage. And your veterinarian should be able to help you with that.
Yeah, really, really good point. And, I talk with my vets about what diet is most appropriate for each cat, and that does make a huge difference. It really, really does make a big difference. So, gosh, I wish we had more time to talk. I just have one last question for you, which is kind of a different type of question, but I just know that right now, throughout the pandemic, it's been kind of really challenging in every industry, but definitely in veterinary medicine. A lot of people bringing their animals in. A lot of people are very stressed, and it can put a lot of stress on the relationship at the veterinarian. I wanted to kind of check in and first of all, be how are you? And then also ask you if you have any just kind of thoughts for people who are going to seek veterinary care about how they can make that a positive experience for themselves and also for the staff who are doing this, very stressful work on behalf of animals.
So absolutely, I've been in the thick of it for this past year and a half, and I see all sides of it, and I feel for everybody, particularly my staff, because they're the ones that have to deal with this and deal with the stress of it. and still perform for our clients and have a smiley face when they do it. And I'll say this, let me start with the owner side. I definitely understand the need for your babies to be seen, or I understand the need for the cats to be seen, and you're concerned about things. Everything isn't always an emergency. And I don't mean that condescending at all. I just mean that everything is not an emergency. And, understand that we're doctors and nurses just like you're doctors and your nurse for humans. And I think a lot of people tend to forget that because they imagine that when a cat loses his hair, they'll come back in. The hair hasn't grown back. If you cut your hair off today, it's not going to grow back in a week. Like, it just doesn't happen. These animals aren't superheroes. The same thing would be with the waiting game. Just like in a human doctor, I go to my human doctor, I wait hours with an appointment. I've been in an emergency room, and waited hours. We sometimes have clients, and I understand, again, you made an appointment, but the impatience that we have as people for each other, we've got to do better. I've been waiting 15 minutes. Okay, I promise I'm going to try my best to get to you. You might end up waiting another hour because there's a sick animal in here right now. But we have to understand to be patient with each other, guys. This is still medicine. Just because it's a cat doesn't make it easier. In fact, it probably makes it harder. On the side of the staff, I understand what they're going through. You got people that are impatient, yelling at them, pushing them. They're stressed. They're seeing more clients than they normally are. It's not enough room, not enough time. It's important to understand what we signed up for. We signed up to take care of animals. This is our job. So we don't leave until the party's over. And when the party's over is when we're done cleaning up. It's a part of the gig that we have, and it's very difficult. But I think if everybody just try to find the peace in it, we always tend to look at things half empty a lot. I don't. I am a much so a glass half full guy. You just have to look at the positivity that's going to come out of it. So it's difficult for everybody. Everybody muster up some courage and some patience and figure out how we can make it work for you. If you can drop your pet off and we've got space, let's drop them off. If you don't need to come in today, don't come in today. Okay? Make an appointment next week when I got 3 people instead of 100. I mean, just let's work together and try to figure things out and understand that medicine is medicine. Medicine is medicine. You're going to wait. And right now, the wait times are real. And unless this is something that is dire where something's dying, please learn to be patient with us and try to work with us to figure out how to do that. That's all I can say about that. It is tough right now.
Yeah, well, thank you. And I think it's so true. I don't know a single person who got into veterinary medicine for any reason other than loving animals and having compassion for them. And I think it's important we all remember that. Be kind to each other, just on all sides, whether you're the person who has the cat or you're the person treating the cat. We all want the cat to be healthy. So a little kindness goes a long way for everybody. And part of that is expressing gratitude to your vet. So I want to say thank you to you for all of the work you do and for, showing up every day to make life better for the animals that you treat. Thank you so much for that and for talking to me today. I think this was a great conversation.
I've had a great time, as always. Thank you for all the work that you do. And if there's anything I can do to help you, let me know.
Thank you, everyone, for watching. I want to, again, thank Royal Canin for partnering with me on this series, as well as the Take Your Cat to the Vet campaign. You can learn a lot more at royalcanin.com/cathealth. And I would love for all of you to join me again next week and stay curious, stay compassionate, and I'll see you again soon for another episode of Cat to Vet Tales. Bye.